Thank you for joining our Contact Center Asia Pacific Leader Talk. This has become regular event, and we invite some leader within Asia Pacific. And today with me, Steve Pels, from Contact Center Action. He is also the live members of Auscontact. And Fiona Keough from Auscontact. She is the CEO of Auscontact Australia. She is very famous for Indonesia. What is the best contact center, because she become judges for many years and coming to Jakarta for many times. Thank you for joining us today. Okay, and today we will talk regarding Contact Center Australia. Both of them are my senior, and I appreciate their contribution to the contact center industry. So let's have their view about the contact center in Australia. I think it's the best time for you to introduce yourself first. Maybe we can start with Steve.
Sure. Thank you, Andy. As Andy mentioned, my name is Steve Pels. I'm the director and founder of a consulting company called Contact Center Action. I'm based in Melbourne, Australia, and I have 25 years experience in the contact center industry, 18 of which as an independent consultant. I have extensive experience with both technology and contact center operations, and my business is very strongly vendor independent. Fiona, over to you.
Thanks, Steve. And it's great to be here at a Cc-Apac Leaders Talk for the first time for me. And Auscontact is a member of Cc-Apac, which expands our influence and our reach, and we're actually part of a regional group of contact centre associations. And as Andy said, I have been given the privilege and honour of judging in Indonesia as a result of that. So a little bit about me and a little bit about Auscontact. So I've been in the industry for 44 years, having a variety of roles, right from being on the phones to heading up large operations of 1,000+ people across banking, credit card organisation, American Express, B2B travel, etc., insurance, and it's been a really, really good ride. At the end of my last role, I was offered the position at Auscontact, and I've been in that role for 10 years. Oversaw the merger of two like-minded associations, and Steve and I did a lot of work together. He is the treasurer of the other association, to bring those two associations together so that the industry in Australia actually knew what to do. They were probably, I suppose the word I would use is confused about where to spend their hard-earned dollars, which association. So Auscontact looks after contact centres in Australia. There are about 500,000 people that work in contact centres in the country, although you won't find that if you go to the Bureau of Statistics, because they don't actually qualify contact centres, and there's some interesting numbers there. The industry is a healthy industry. Steve has been consulting as one of the head consulting firms in the country for a significant period of time, and that doesn't happen if the industry doesn't have a wonderful pulse and life. So that's a bit about the health, and of course, Auscontact provides accreditation, certification, professional development, awards programs, conferences, networking events, pretty much anything. At the moment, we're doing mindfulness sessions for our members, just to do something different, because it's stressy out there at the moment. So that's it. Back to you, Andy.
Thank you, Fiona. It seems that you are traveling around the Asia Pacific as well, traveling around Australia to conduct Contact Center Award. Okay, it has been very tired, but you're happy.
Oh, yes.
Thank you. Before I continue with the question, maybe Steve want to introduce what is the Contact Center Action doing.
We provide consultancy services in contact centre operations and in technology right across the board. So basically, anything that needs to be, anyone who needs any help whatsoever within contact centres, we can usually help them out. And like Fiona, I've also had the honour of judging the Indonesia Contact Centre Association awards on multiple occasions, and found that one a very, very enjoyable experience as well. I love Jakarta. It's a great place.
I see. Thank you. Okay, let's start with I think you may want to explain about what is the situation in Australia when the pandemic is starting. Go ahead, Steve.
Yes. So I guess what we're talking about today here more than anything is the pandemic, the COVID-19 pandemic, and how it's impacted Australia, what contact centres did in order to react to that, to the event, and what they should be thinking about now and potentially further into the future. Now, Australia, as I'm sure you're aware, is a huge country, and it's divided up into a number of different states. So I can give you a bit of an overview of the Australian situation with COVID, but from state to state it was different. So a lot of what I'm talking about here is based in Victoria, because I'm based in Melbourne, Victoria, and I'll give you a brief overview of that and then perhaps hand over to Fiona, who can talk about how New South Wales was different, because Fiona and I are actually both in different states. So our experiences would have been different because our governments had different policies and that sort of thing. So Australia saw the very first cases of COVID-19 on the 25th of January 2020. In Victoria, our restrictions commenced on the 16th of March 2020. So there was about 6 weeks or thereabouts before our restrictions cut in. The national restrictions commenced almost a week later on the 20th of March 2020. And that included our international borders being closed. Anybody who did come in from overseas was forced to undertake quarantine in designated hotels. They were required to undergo PCR testing, and they were actually in quarantine for 14 days once they arrived in Australia before they were allowed out into the community. The Victorian lockdown commenced on the 1st of April 2020, and that included all non-essential businesses being closed. So any business that wasn't decreed an essential service was effectively shut down if you couldn't work from home.
I see.
Everybody had to work from home, and the essential services were things like doctors, medical practitioners, food stores, pharmacies, that sort of thing. But most retail was effectively closed. You couldn't buy clothes, you couldn't buy shoes, you couldn't do any of that sort of thing because, of course, that wasn't available from home. Everybody who could work from home was instructed to work from home.
I see.
And here in Victoria, we had 6 separate lockdowns over the main 2-year period. They totaled 262 days in total, and the longest being 111 continuous days. And there has been reports that we are the most locked down city in the world. We have been locked down for more days than anybody else. And that lockdown entailed a 5-kilometre radius around your home. You were not allowed to be more than 5 kilometres from home.
Okay.
You could not visit anybody. You could attend a medical facility if you needed to. Everything was closed except for essential services. Everybody was instructed to work from home. If you needed to go out and buy food or anything like that, one person per household could go out once per day.
I see.
And that is all. Other than that, you were tied to your home. And you, as I said, you weren't allowed to visit anybody. So my children don't live with me anymore. We couldn't see the children for weeks at a time. So it was a fairly stringent lockdown here in Melbourne. Fiona, how did you go in Sydney?
Well, luckily, Steve, I don't live in Sydney, but I got out in May of 2020. I must have seen the light very early. So Sydney wasn't quite as strict as Melbourne, but picked up some of the things that Victoria were doing, and in particular Melbourne with the 5 kilometre radius that then became a 10 kilometre radius. We had the longest lockdown we had in Sydney was 11 weeks. And during that time, we had what we called a buddy bubble. And you were allowed to visit somebody that was no more than 5 kilometres away from you, even with the limitations. And so because people were isolated, they were on their own in their homes, not able to go out, and that was creating mental health issues. And that was one of the things that was recognised, but not till really late in the piece. So I'll give you a for example. So as I said, I left Sydney in May of 2020 and we decided to sell our house in the middle of COVID. So my husband was in Sydney in our home and he had sold all the furniture except for one room and was just waiting for the removalists to come and bring the furniture to where I am, which is about 2 hours away on the beach. And he fell down the stairs at home and broke his tibia and his fibula in 2 places and was due to come here and wasn't answering his phone and didn't arrive. So I had to ring our son, who was his buddy in the bubble, to go and see if he was okay. He went there and he found his dad on the floor, called an ambulance. My husband went to hospital for 2 weeks because he had done such major damage. Then he went into rehab for another 2 weeks so he could learn to walk. And I was allowed to drive to Sydney to the rehab facility he was in, collect him and turn around and drive back. I was not allowed to go to our home and pick anything up. I wasn't allowed to do anything else. So there were some fairly strict things in place. In Sydney, similar to Melbourne, nobody was allowed in the office. And what we saw was large organisations taking the opportunity to give up their real estate. As soon as the lease was up, they were out. So we could talk about some of the larger contact centres in Australia, and one is one of the big 5 banks that pushed everybody to home as they needed to, and they had 24,000 people at home. They contacted me because they needed 10,000 headsets because they had all of these people at home without the kit to be able to do the basics, and their procurement team couldn't do it. I didn't get to 10,000. I got to 7.5. I got somewhat of the journey there for them. But nobody was prepared for what was to come. Nobody was in the right position and nobody was able to predict how things might change. And I think that's the same worldwide. We just didn't see any consistency anywhere, did we?
No.
Yeah, I agree. I think no company prepare for that. Yeah, especially 10,000 is immediately is very difficult to do that. Okay, thank you for the sharing. So Fiona has started about what contact center do for their agent. How about Steve? Can you share what contact center did for that condition?
So yeah, and this was the interesting thing. At the very start of the pandemic, there was still a lot of contact centres that had premises-based telephony equipment. So all of their hardware was on site, which meant in most cases staff could not work from home. So when the government said everybody has to work from home, and we got about a week's notice, I suppose it was, Fiona. It wasn't any more than that, but basically they said from next Monday, everyone has to work from home.
Next
Monday, everyone works from home. That's what happened. It was exactly how it worked.
Immediate,
so there was dozens of organisations who could not do it. Their premises-based telephony equipment would not allow staff to work from home. So they had to very, very quickly look at alternatives. And the very short-term alternative in many cases was to put an announcement on their IVR saying, I'm sorry, due to the pandemic, our call centre is closed. Please send us an email to this address.
I see.
And then people did work from home, but they were only working on emails because, of course, that they could get from home. That was available everywhere. Now, we were really, really lucky that because this was a new experience, no one had seen this before, customers were relatively understanding, particularly in the early stages. So they understood that these organisations were in a place that they'd never been before, and they were very forgiving. They understood that it was going to take a lot longer to get an answer and that people were doing the best they could. That kind of wore off later on because it became the new norm. But in the beginning, it was fine.
I see.
At that point, a lot of these organisations started calling telephony vendors, and speaking to a lot of the vendors around, they were selling cloud-based contact centres faster than they could supply them.
I see.
People were buying these centres and having brand new complete contact centres stood up and going within 48 hours.
Oh, okay.
So
2
they
days.
were 2 days to set
2
up
days
a
only,
contact centre on cloud.
I see.
And that, of course, then meant people were able to work from home.
I see.
They were still trying to push people to email because it was easier to deal with. With things like chat and phone, you're susceptible to internet problems and that sort of thing. So because this was done so quickly, in many cases, there were some issues in call quality and that sort of thing afterwards. So there was still a focus on servicing via email where it was possible. Most outbound calling stopped because it was seen as non-essential. So a lot of the sales and that sort of thing that you would see in as far as outbound is concerned, that was temporarily stopped. The focus became on inbound customer service.
I see.
The contact centres that they set up in the cloud were what we would refer to as minimum viable product. All they wanted to do was to deliver the call to the agent. There was nothing fancy about it. There was no integrations to back-end systems. There was no CTI. There was none of that. It was just a case of deliver the call as quickly as you can. So it was still relatively inefficient. And what that then meant was that after that was complete, there was a whole lot of cleanup and things like that to do afterwards to put in place the functionality that previously existed, to customize the reporting, to configure the new workforce management system, to build the integrations and CTI. All of that sort of thing came later. But the important thing day one was deliver the calls. There was a lack of planning. Normally when you do this sort of project, you'd sit back and say, all right, what are we doing today? What can we do better? How can we change the way we operate? That didn't happen. It was really a case of what have we got today, build it exactly the same and let us keep working. So there was no improvement. The absolute best scenario was like for like with what they had previously.
I see.
As I said, the focus was deliver the calls.
I see.
Yeah.
After that, there were ongoing lockdowns and travel restrictions that I've mentioned before, and that slowed down, if not prevented, the delivery of enhancements. Because people couldn't get to site, couldn't do discovery, couldn't do the architecture work, couldn't do the design work because they were all remote, that was very much left to one side for later on. And the other really interesting thing that we saw was a lot of offshore contact centres came back onshore because a lot of the larger organisations felt that they had less control over their offshore sites. At least here in Australia, you could see the number of cases increasing. You could see what the government was doing, and to a degree you could predict where it was going to go, where the close downs were going to happen. Where the contact centre was overseas, we didn't get that information. So there were incidents in the Philippines and incidents in India where the contact centre shut with absolutely no warning. And of course, the Australian company was left, with no contact centre. Yeah. So they sort of felt in many cases that they bring the contact centres back on shore, where at least they had better control, better visibility of what was happening. So that was another interesting thing that came out of it. I guess that's a summary of the initial stages of the pandemic.
I see. May I ask, is it normal in Australia, people, that they are already prepared with the computer at home, so easy for them to work from home?
No. In many cases, it's not.
So you need to provide them with the computer and...
So the challenge was, Andy, that most people that work in contact centres work with a tower and a monitor, not with laptops, so not easily transportable. So that was an issue. What it exposed was that most business continuity plans, which is what people really needed to go to because a pandemic is part of a business continuity plan, actually didn't include remote working in their business continuity plans, or the plan said go to a satellite. Which you weren't allowed to do. So I would add to Steve, with the overseas operations, was not only was it about control, it was about the fact that in those countries people were told to work from home, and the infrastructure in those countries where those people came from, because they tended to be more out of the city and commuting to town, it didn't exist at home and they couldn't work from home. The other thing that we also found in the very early stages, with people just going home because they had to go home, work health and safety regulations were no longer the focus. People would go home, they'd be working on their dining room table, they'd be homeschooling kids, their partner would be working in the house. So it wasn't an ideal situation. And so people were putting at risk, being covered by work health and safety, if anything, untoward actually happened. So it was quite serious. Not only was the technology underdone, it was also the people aspect of it as well.
Very much. Yeah.
Very much so. Yeah. So that, it was a multi-dimensional problem that we had, which everybody had. Let's face it. Australia, whilst we are an island, is not isolated in the challenges that we faced.
No. And I guess just to sort of add to your question there, Andy, as Fiona said, not a lot of people at home necessarily had PCs and that sort of thing. But where they did, they had to have software installed. They had to get the VPN connected and all of that sort of thing. So there was issues there as well. And we also found a lot of issues around internet connectivity. We were finding a lot of call quality problems and that sort of thing. And when we dug down to it, we'd find young people in their early 20s or whatever ever in a shared house. One of them was trying to take call centre calls and two others were watching Netflix at the same time, streaming videos. And we were wondering why we were getting poor call quality. So there was all sorts of challenges around that as well. But, companies were trying to catch up as rapidly as they could. I mean, I was working with one of my clients at the time who virtually as soon as this happened, placed an order for 900 laptops.
I see.
And they had these laptops built and they replaced all of the desktops and they physically took these laptops to every single staff member's home and said, that's your laptop from now. You work as a call centre agent from home using our laptop. And what we found here, and I'm sure it's worldwide, we ran out of laptops. You could not buy laptops. And as Fiona said, you could not buy headsets. All of the hardware that we take for granted was completely unavailable very, very quickly.
I see. Okay. Oh, thank you. I mean, that the situation, that's similar in every country is like that. But when the next thing, what happened in Australia when the traffic is increased, I think, but the human resources, the agent may be less because offshore become onshore. So Yeah.
Yeah. So what happened then was actually really, really interesting. In some industries, interaction volumes increased dramatically, very quickly. Things like retail, like you couldn't go into a shop and buy things anymore. So that was all online.
Okay, they
And
buy
then, of
online,
course,
yeah.
So
They buy
then, of course, you've got a contact center behind that to support it. So in retail, in banking and that sort of industry, we saw the call volume spike dramatically very quickly because all of the face-to-face traffic became online or contact center.
Okay.
I was at a function last night talking to some people from a university call center, and they said their volumes dropped dramatically straight away because we have a very, very large percentage of international students here in Australia. A lot of people come to Australia to study. And because they couldn't get in, the borders were closed, there were no students. So the university call centres went very, very quiet very quickly.
I see.
And there were other industries, particularly travel, airlines and accommodation, that saw a dramatic spike initially. People cancelling holidays, cancelling air travel, asking for refunds, wanting to know what was happening, rebooking for a later time.
I see.
Okay, so there was this dramatic spike first on, but then because the borders didn't reopen and people weren't allowed to travel, their volumes dropped right off as well.
I see.
So every time there was a lockdown or something like that, they would see a spike.
Yeah.
With people cancelling and moving flights.
Yeah.
But then it would stop because people weren't allowed to travel, so they weren't making bookings, they weren't making inquiries.
Yeah, so we saw a lot of those travel people move across to the BPO sector very quickly once the spike finished. I guess the other area, Steve, that really spiked quite quickly was government. Especially Services Australia and the tax office because of JobSaver, etc., things that the government made available to us. You know, I was talking to one of the heads of operations at Services Australia, and he was saying their calls spiked to 100,000 calls a day, but they're now at 200,000 calls a day, and we're at the end of the pandemic. So that's interesting. And I guess the other place is the tax office is responsible. And you're Indonesia is very familiar with the tax office because we work very closely with you guys. Tax office absolutely inundated with people trying to get hold of benefits that were applicable to them. When am I going to get paid? And having to apply online. And what we also found, and we helped a number of government agencies that had never had a contact centre. So the agency used to handle their calls using a receptionist, like ring the main number, and then she would put the call through to somebody in the department that might know the answer. So we helped stand up a number of government agencies, especially around contact tracing. We'd never had contact tracing.
Yeah.
So, and that was the responsibility of each state. It wasn't managed centrally. So we had it multiplied by 7.
I see.
So, and everybody did it differently. Nobody did it the same way. There were some very mature operations, some very immature operations. So, I think Steve is bang on the money in terms of the initial spike. And, of course, retail, as he said, was hit. But then once you buy, that parcel's got to get to you. So these companies were absolutely run off their feet. Where's my parcel? Where's my undies? Where's my hat? Where's my whatever? And the other thing, of course, in Australia that went really doolally was this is not necessarily contact centre, but it did create a volume into contact centres was the lack of toilet paper. Australians decided that you needed to stock up on toilet paper for at least another 6 to 12 months. And every time there was a lockdown, the toilet paper would disappear from the shelves. And so people would be calling the main supermarkets and saying, when are you getting it in? When are you getting it in? I need it. Like, how many rolls do you have? Oh, 24. I don't think it's urgent. Because there is no linkage between toilet paper and the pandemic. We've managed to work that out. There you go. The behaviours of people that changed, that drove volumes in, that was just bad demand as well.
Yeah, very much.
Yes. Well, I mean that you mentioned about the government that they don't have a contact center. So how they did? I mean that.
So it's very difficult in government to move people out of their banded, structured roles because it's very much, I'm going to say, unionised in terms of what people are allowed to do and not allowed to do. I think the difference was this time around is that people recognised that this was a 1 in 100 years occurrence or whatever it was, and that they just needed to shapeshift. They also started employing more people. Some of them also reached out to various BPOs and used the BPO relationship. But the BPOs were struggling to get talent. There was one BPO that needed to stand up 800 people in a 2-week window. I don't know how you hire and train 800 people in a 2-week window.
I see.
I had the space, but they did. That was in Brisbane. They did it. And we saw a lot of movement around, Steve would be aware of this, is when a travel operation was closing down, that their infrastructure was being leveraged by other companies. So other contact centres were moving into where the infrastructure actually existed as well. So that was good. But, we still have issues, and we're 2 years in with, the big...
Anyway, the BPO in Australia is still alive. I mean you still have a lot of BPO? Or
we have
still a lot of
them moving to India and Philippines?
No, big industry in Australia still.
Okay.
Very healthy, and a lot of growth. If anywhere grew during the pandemic, it was the BPOs, because they were the most likely to be able to stand people up, and they had processes in situ because they work on a contract basis they knew how to get people quickly and to make it work. Yeah.
Okay. When the spike of request services, do you think they're using AI or something self-service?
No, not at that stage, because they had to do it as quickly as they did. There was no time for that. In most cases, they just had to throw people at it or, cope as best they could. And as I said earlier, try and direct some of that to email and to other channels as well, or answer questions if they could with recorded messages, that sort of thing, to try and reduce the volume. But there was really no time to do all of that technology, nice things. That's still to come. I think that's probably going to be the next wave.
You're absolutely right. But penetration in Australia is only 14%.
Yeah.
So think about what's left on the table. There's a heck of a lot more that we are able to do, should we so desire.
Yes. So overall, there's a lot more reliance on contact centres today because interactions are more remote. And what I think the pandemic has done is it's changed the mentality of a lot of people who felt they had to deal face-to-face, like they had to go to the bank to do things, or they had to go into a shop to buy things. They've now realised they don't. So there's less foot traffic around the place, and people are transacting more over the web or via a contact centre or using remote means. So the reliance on the contact centre is greater now than it was pre-pandemic.
Yeah, and then it become a very good experience for them. Yes,
they realised it's possible, and they realised the experience is quite good. So I don't think it's going to go back all the way to where it was before. I think this has been, if you like, the catalyst of change for the way people operate. So it's going to be interesting to see how it goes further. But the undisputable fact is there's more reliance on contact centres. They are more important today than they were 2 years ago.
Is it also mean that maybe some Australian company not really want to offshore anymore because they think that they can do it in onshore?
Yes, the attitude to offshoring has certainly shifted during the pandemic. It's not that people won't do it, but it's not as, I'm going to call it flavour of the month, as it used to be, which, it used to be all about cost, the lack of service. But now As Steve said earlier on, during the pandemic, large organisations were bringing their contact centre staff back on shore. He cited India and the Philippines. We know of an insurance company that had an operation in South Africa, and their workers got infected on a bus on their way to work, and the contact centre had to shut. So they actually had to do all that work on shore here in Queensland. There's quite, and agents in Australia are quite expensive. We're talking entry level at 60,000 Australian dollars at entry level. We just did a salary benchmarking report, and that's new people that have never worked in a contact centre, and it's only upwards from there. So it used to be, when Steve and I were around back in the day, a relatively poorly paid role.
Not anymore.
Not anymore, because you need people that can have complex conversations.
Yeah.
And that is how it has shifted. And, organisations are now suddenly realising the strategic importance of their contact centre. It used to just be considered to be a cost centre and, just a money pit to waste money in, as opposed to now it's absolutely their heartbeat and their only way that they can, in many respects, connect with customers as they would like to going forward.
And then, that most contact center, I think they're thinking to redesign their procedure to be for the remote working and quality control and business process, all the things they are redesigning now.
Yeah, so there's a whole lot of interesting things there. As we said earlier, the big focus was on moving to cloud.
Yeah.
So organisations should, if they're not, but they should certainly be now looking at that cloud solution and saying, is it actually the right one for us?
I see.
Because they didn't necessarily go through all the normal due diligence that you would go through when you buy a new system. It's a case of give me a system and make it work. So is it actually the right one, or is there another solution out there that is better that they should be thinking about? If it is the right one, has it actually been configured the right way possible? Like we said before, that in a lot of cases, they did like for like. So they picked up the design of their existing call flows and built it in a new system. So has the new system been configured in the best way possible, or has it been copied from the old system? And different technologies have different capabilities, different functionality. So it's a case of looking at what you've got and leveraging that. Do the call flows and IVR trees actually need to be reviewed? Are they operating the best possible way? Is there additional capability available now that's not being used? Like technology vendors today tend to bundle functionality. Like when you buy call recording, you automatically get QA. When you buy workforce management, you automatically get other components. So, you may well have functionality that you didn't realise that you actually bought because it's included in part of the package. So, and of course, new systems have capabilities that we've not seen before. They have AI as standard in many cases. They have virtual agent. They have customer sentiment analysis. They have transcription, and automatic QA is readily available. So have you actually bought this without realising it? Or if you do realise it, are you actually using it? Or could you use it? Is it right for your organisation?
Yeah, I think that's absolutely right, Steve, in terms of what people have purchased. But what the other aspect to this as well is the technology is one challenge. We also have another challenge that's emerging, and it's an employees market.
Absolutely.
Which we'd not seen before. And so now we're seeing through some surveys that the job vacancies that were around in contact centres are now double to what they were in the pre-pandemic era, that 30% of organisations are now reporting unfilled vacancies. 38% of employees are planning to leave in the next 12 months. PricewaterhouseCoopers said 90% of workers ideally want some form of remote working, and that 72% will quit if flexible working demands are not met. So we're seeing the control shift. We can have great technology and all of that, but if you don't have the human at the other end, because we're still very largely human-based, then Houston, we've got a problem. We really do. And it's a significant shift. It used to be very much the workers, I'm going to say suppressed, it's not the right word, but we're not in control. We're not driving the agenda. They are very much driving the agenda. And so flexibility with a capital F is at the top of that agenda at the moment. An organisation not offering
how about the chatbot that replacing the people? Is it Australian? I mean, willing to do that.
Look, we've seen some of that. Some organisations have done it to differing degrees of success, but in my view, I think a lot of that has slowed right down in the last 2 years because people have been focused on just delivering the call. They haven't been able to or haven't been focused on designing that sort of thing in order to pick it up. And to go also to Fiona's point about lack of staff, there's a lot in that is actually beyond our control. For example, right now, if one person in a household catches COVID, then that entire household has to isolate for a week. So you can have 4 or 5 people who are quite well, they haven't been infected, they're not allowed to go to work. You multiply that across a contact centre and you've got a big absence problem. The other issue is that a lot of our contact centres still are staffed by people on working holidays, backpacking around Australia. We've got a lot of our agricultural industry, for example, fruit pickers and vegetable pickers are actually overseas workers, which haven't been able to come into Australia. And a lot of the people that work in our hospitality industry, restaurant staff, hotel staff, that sort of thing, are also overseas workers that haven't been able to come into Australia. And in many cases, contact centres are not seen as prestigious jobs. So there's a whole movement at the moment of people filling jobs in other areas, which has a knock-on effect to contact centres as well, which is overall contributing to our lack of staff. And it is a real issue. It's not only contact centres, but it's across a lot of industries, but we are certainly affected.
I see. And how we overcome about that?
Well, we are hoping...
It's not easy to find the staff.
No, it's not. Different states have different rules about isolation regarding COVID. Some states, it doesn't matter. If there's someone in your house that's affected, then you can still go to work until such time as you test positive. Here in Victoria, that's not the case, but in some states it is. Our borders are now open. We can travel to and from Australia, and as of, I think it's the 18th of April, I was reading earlier, you don't even need a negative test to come into Australia. There's no quarantine, there's no nothing. So that is going to open it up for university students who are looking for part-time jobs, for overseas staff who are coming to Australia to work, and all of that sort of thing. So that is going to alleviate the problem to a degree. But there still needs to be a shift of priority. As we said, a lot of the shopping, retail has moved from face-to-face to online. So there needs to, at some stage, be a corresponding shift of staff. You're going to need less staff in shops and more staff behind the scenes.
I see.
As Fiona also pointed out earlier, transport is a massive problem. The number of parcels that are being moved around Australia needs van drivers to do that. And there's a big shortage of drivers and transport workers and that sort of thing as well. Our unemployment rate right now is at 10, 15-year lows, Fiona. We have got far less unemployment right now than we had before the pandemic.
Yeah, I think it's less than 4%, Steve. It's
very, very low.
Very low. And, we don't have mandated roles here in employment. So, normally we would see it around 10 to 12% unemployment. And it varies, again, state to state. But, Steve's very, very right in the our reliance on workers, our seasonal workers that tend to come from overseas and the universities, etc. Even some of our states only opened up to the rest of the country last month. We weren't allowed to go to Western Australia, unless we wanted to sit inside a room for 14 days and wait to be allowed. So it's stopped so much of the normal traffic of people being able to commute from state to state. It's made it all the more difficult as well when you have a national contact centre that has sites across the country in different states, and I've got one set of rules in place for my team in WA, and one set of rules for my team in Melbourne, and one set of rules for my team in Queensland. It makes it really, really difficult to operate consistently for your people as an organisation as well. So, we still haven't cracked that acorn yet. I think in terms of itinerant workers, contact centres, because we're less transactional, less inclined to employ itinerant workers, because by the time they want to move on, they've only just reached their level of competency. And so it's not an attractive proposition. They really want people that are going to be there for 18 months, 2 years, and that typically doesn't happen with itinerant workers. And they're out here on a holiday or whatever, so you don't blame them. They don't want to be stuck working. They could be doing that back home.
How about the remuneration for the staff? Is it changes? I mean, is it company make changes on the remuneration for the contact center staff?
Well, working from home versus in the office? Or, no, it's exactly the same. There has been some noise around paying people less when they're working from home because they don't have to travel and that sort of thing. But I haven't seen anybody actually move to that. I think there would be absolute anarchy. You're paying them for the job that they're doing, not for their travel costs, etc. So provided they're delivering a quality outcome, the pay should be absolutely the same. So that's our view as an association. And we still have, as I said, we haven't seen anybody actually be loud and proud and try and do that yet.
It's actually an interesting question because there's two opposing views here. I mean, as Fiona said, there has been a lot of noise about reducing staff's salary, not only for those reasons, for travel and that sort of thing, but the company no longer has to supply a workstation and an office for that person to work in. So the company is paying less for that worker per se because they don't have the real estate. On the other side of things, the worker is now using their own internet. They have to supply their own desk. They have to supply their own chair. They have to supply their own power for the air conditioning and the heating. They have to supply their own coffee and tea and refreshments, which they would otherwise have in the office. So there is a corresponding argument to say, hey, you should be paying them more. So, because their personal expenses have gone up in those areas. So, look, I think it's a trade-off. And as Fiona said, we haven't seen anyone take one path or the other. And I guess there's an argument both ways, but I don't think it's going to change. I think it's going to stay pretty much as it is right now.
I see. Okay, thank you. So, and then actually there is question here, but we will answer it later. How about the management? How they manage the team during this, and what is the current condition now?
Yeah, so look, that's a very interesting thing. I think there's a lot of organisations at the moment which are now starting to battle with this. Okay, what does the future look like? Are we going to continue working from home? Are we going to continue, or are we going to move back into the office? Are we going to offer both? Now, there's pros and cons for both ways. I mean, a lot of the staff want to work from home. There's no question about that. Fiona mentioned the figures earlier on. There's also a number of staff that would prefer to work from an office because they want the social interaction and things like that. And there's certain aspects of people's jobs, like training, for example, which are a lot easier to do if people are in the office. You also get more support. I mean, if you get a call that you don't know how to answer, it's very easy to tap the person next to you on the shoulder and say, hey, how do I do this? Or how do I deal with that? Or have you ever come across this question before? Can't do that when you're working from home. So I think a lot of managers have started adapting to more frequent meetings than they would otherwise. I mean, like first thing in the morning, a daily Zoom meeting or something like that, just to catch up with staff and make sure everything's okay. But that in itself creates an issue, because if you're in an office and someone is having psychological issues, for example, you might notice them start to get very quiet, or you might notice that their appearance changes, it becomes more disheveled, or they appear more stressed. It's much, much harder to detect that over a Zoom conference or something along those lines. Yet the current environment is causing a lot more psychological issues than we've ever experienced before. So organisations are trying to do the best they can. I mean, I've heard of a number of organisations of late that say, if we are doing a Zoom meeting, your camera must be on. It's as simple as that, so that at least they've got some idea on the person's demeanour, on how the person's feeling, and they might pick up on a couple of triggers that would indicate that there's an issue. But it's much, much more difficult to do. And the thing with Australia too, this may not be the same overseas, but in Australia, even if you are working from home, the organisation has a responsibility to a degree for your occupational health and safety.
I see.
So if you have an accident at home while you are at work, there is a question of liability to your employer. So it is your employer's best interest to know that your workstation is ergonomically correct, that you are not going to cause yourself an issue, that your heating and cooling is appropriate and comfortable, that you don't have power leads lying all over the floor to trip over and things like that. And that's another issue, because how do you actually determine that from your staff's perspective? There are organisations that have asked their staff to take a photograph of their workstation and send it in. But first of all, how do you know that's their workstation and they haven't gone next door to photograph the next door neighbour's workstation? And how do you know they're going to keep it tidy and clean like that? It's very difficult. Fortunately, we have some tools that we can use along those lines to try and reduce that risk as much as possible. But managing remotely is a lot more difficult than managing in an office. But organisations have to realise that that's the new norm in a lot of cases, and they need to adapt to it. They need to do it.
Is it mean that they need assessment of doing that?
Yes, they do. And legally, they are actually supposed to physically inspect everybody's workplace. Now, that has not occurred. We found at the start of the pandemic, 85% of organisations were doing nothing other than asking for people to send in photos. And as Steve said, you don't know if that's next door or wherever. And so that is problematic. I'd like to also add to a couple of Steve's point about leadership. With regard to mental health. So we lost $20 billion in 1 year with mental health absenteeism in contact centres alone. That is not insignificant in terms of absenteeism. And it is the one thing that we are still struggling to address and address appropriately. It was an issue beforehand, and we were on site with people and we could catch people doing something well, and we could see all the visual cues about whether they were well or unwell, and we could walk up to them and tap them on the shoulder and say, you've done a great job, that was a great call, or that sounds like a terrible call, you probably need to go and take 5 and have a bit of a relax. But, you know, the emotional labour that we're asking people to take on, especially as every single call we ask people to be nice. Start the call off being nice. So you've just had a call with somebody and they've said something really horrible to you. And then we expect you to suddenly switch the button from being, oh, I feel terrible, to being, I'm really nice. The emotional labour is huge, and that is where mental health challenges come in. Whilst we can have our cameras on in Zoom, you know, Andy and Steve, you know I'm as sick as a dog today, right? But you wouldn't know by my, well, I don't think you would know by my persona at the moment that I feel terrible at the moment. But yeah, and so it's not always effective. We have to train our leaders to understand those cues. We have to train our people to understand the cues within themselves. So as a leader, so we recognise it through technology for our customers, because there's technology out there that will tell you when someone has some issues, whether they be mental health issues or whether they have hardship, etc. You can use some of the language that they're using to make a determination through the technology. We don't do that with our people. It's not it's not out as much as you would hope it would be. We would also need to get people's permission to do that analysis and to make those assumptions about them. So we have a lot to do as a leader. We need to amplify ourselves. When you're working remotely, being on Zoom, you can't be really passive and just kind of do it. You have to sit up and lean into the conversation, and it's almost like you're doing a show. So your energy levels are higher. And your need to communicate is greater. Communication has always been a challenge, but if anything is more important these days is communicate. And when you thought you've already communicated, do it again, because because people are remote and you can't check their understanding. And when you get so much via email and via chats or whatever it happens to be that you're using as your communication tool, you actually don't know how people are reading that. What is the baggage? And, you know, some people have a plane load of baggage that they're reading that communication with, and others are just on board. But you don't have that opportunity to kind of steer them in the right direction or answer their questions immediately. There's a lot of people, if you say, are you happy with that? Are you okay with that? They will just say, as the Australian thing is, yeah, I'm fine. And really and truly, they're not fine, but they don't like to say they're not fine. It is a long-term problem for us.
Is it mean also because the leader also need to take care about their mental health as well, but not only the staff but also the leader itself to become motivated, to tell them many times, reminder them, something like that. So what do you
understand it within yourself before you can understand it within other people? That's absolutely critical. And there are many organisations in Australia that provide that training. It's not difficult, but it is absolutely a wonderful thing to undertake, because not only do you position yourself to help your people, but you can become a better version of yourself. And that's fantastic.
Okay. Steve, you want to add something?
No, I think that's right. I mean, we do definitely see mental health issues with team leaders and management and that sort of thing as well. And in some ways, you know, that's harder to detect because there's not necessarily a leader looking at them as often as a team leader looks at their staff. So it can be harder to actually detect a problem in a people leader than in frontline staff. But it is just as critical for sure.
Okay. Talking about the next condition, I mean that the current condition, so post-pandemic.
Not post-pandemic.
Not yet. We are still in the pandemic situation. We hope to be soon.
Look, I think now's the time that organisations need to. I mean, because we've been in and out of lockdown, there's been a lot of apprehension to do any forward planning, any strategic planning of that sort of nature. It's been a case of let's just keep the doors open and the lights on and keep going. But that can't go forever. I think it's high time now that organisations started rethinking strategic planning. To hark back to technology, have a look at what's changed. Remember your business continuity plan, because people think that cloud contact center or cloud technology doesn't crash. It does. So we still have to have some sort of business continuity plan to allow for any issues. In some ways, it's more complex because you've suddenly got communications links back to your cloud provider, or you've got firewall issues, you've got VPN issues, you've got all sorts of things like that which need to be catered for. And what do you do if one of those goes down? But you've also got to start thinking of the future. What is your strategy? Do you want to start leveraging some of this capability like AI, like virtual agents, like sentiment analysis, like transcription, all of that sort of stuff? Do you want to start doing that? And then, of course, you've got the question around, okay, am I going to have people working from home? Am I going to have people in the office? Is it going to be a hybrid? What does that hybrid look like? How much choice am I going to give to my people in order to retain the staff, because I can't afford for people to be resigning. There are no staff out there. So we need to be flexible as far as that's concerned. But by the same token, we need to make sure that we are meeting the business goals and fulfilling the business needs. So I think now's the time for organisations to start having a very close look at what they've got, where they are positioned today, and where they want to go in the future. And in many cases, that's going to involve some external help. It needs to, you really need to engage someone who's out in the industry, who sees what other organisations are doing, who understands what your technology capability is, and can best advise how to do things, considering all of that to benefit your organisation. It's fine to try and do it internally yourself, but again, you're not necessarily seeing the big picture. So in many cases, it's worthwhile engaging someone external to effectively do a health check on your existing contact centre and help you develop a strategy for the next year, 2 years, 5 years, considering what we've all just come through.
Yeah, I agree, Steve. I think what they're also doing at the moment, with the pandemic, everything was put together with Band-Aids and string and whatever. So what they're doing now is just making sure that that's all well bolted together, for want of a better term. And then, I call it mopping up and then looking to the future. I think their strategies around using artificial intelligence or their thoughts around artificial intelligence, etc., needs to link directly back to the organisational strategy. We still have about 90% of CEOs standing up in public and saying the way that I will differentiate our organisation is through customer service. Does AI equal customer service? Does chat equal customer service? And I think, for some people the answer is yes, and for others the answer is not necessarily, and for others even more strongly the answer is no. With complexity comes the need for people. I don't think AI will get there. I think we have some challenges around the artificial intelligence being able to show empathy, understanding the sarcasm that we use in Australia. In terms of doing the analysis and knowing how to best respond, I think there's still a bit of a journey to go on. And as I said, only about 14% of organisations are using bots at this point in time. So we do have a long way to go. Steve is also right around people working from home. So whether you have a on-site, totally remote, or a hybrid contact centre, the only way to work out what you want to do or what is best for your organisation is, if you truly value your talent, is ask them.
Absolutely.
We know from our recent survey that there is double the organisations. So 31% of organisations think that people don't want to work from home 4 to 5 days a week. Sorry, it's the other way around. 15% of organisations, if only I could read and my brain was functioning, 15% of organisations say that their staff only want to work from home 4 to 5 days a week, but 31% of staff in that same survey said they wanted to work from home 4 to 5 days a week. So if they can't find that middle ground, that's where that exodus is going to happen.
Nice.
You need to work it out.
Thanks, Fiona. We have a question here, so I may ask Pak Sudibyo if you want to ask directly, or I read your question to Steve and Fiona. Pak Sudibyo, you want to ask it directly?
Okay, can you hear me, Andi?
Yes, you can.
Yes,
Yeah, okay. Hi, Fiona and Steve. Actually, some words from you already answer indirectly. But my question is, during the pandemic, in this chaotic situation, for sure it will bring risk, especially in the data breach, because if in the office and so on, you have full control. But if your staff is working from home, then you losing control, especially for the data, and especially for the banking industry, insurance, and so on. Those data is very important. So my question: what is the most of the companies did to avoid this data, data breach? Okay. Then can I continue? My second question is, Andi maybe already say about this. After this 2 years pandemic and still long way to go, I don't know. Some states already opened the border and so on. Actually, what is the most this pandemic situation driven the technology? I just need some your insight. What is the most technology that developing because of this situation, with cloud, with automation or other things? Then my third question, whether especially in the Australia, where the people or organization feeling more, feeling that the contact center is getting more important, in the organization, one division of the organization that is, very helpful and, pick up other division and so on. You cannot doing sales, or you cannot doing direct sales and so on unless you doing those things. So with the feeling of the management of the founder and so on, that the contact center is getting more important. Thank you.
Okay.
Thank you, so go ahead, Steve.
All right. Perhaps I can start with the beginning. As far as data security is concerned, probably what organizations are doing most is, first of all, supplying company-based laptops, which they have a degree of control over where it's possible. And as we said before, some cases that was possible, some cases it wasn't. But where it's possible, they supply a company-based laptop which has the same types of security controls and administration controls and that sort of thing that your in-office desktop would have. The second thing is to make sure that staff are accessing via VPN, which then means that if you are, we call it split tunneling VPN. So if you are VPN'd into the organization, all of your traffic goes through that organization. Even if you were to log into your bank's website, for example, while you were on the VPN, it goes through the company's firewalls and the company's internet access, not your own. That gives the organizations a degree of control and a degree of restriction over what you can access and what you can't access. Unfortunately, one thing that doesn't cover off is other people's in the household who might be standing behind you while you've got customer records open in a CRM and doing work. And that's also part of the reason why a lot of organisations are saying if you're having a meeting, the camera must be on, because that then gives them an idea on what's happening around you in where your work is. If there's a whole lot of people wandering around while you're in a meeting and that sort of thing, chances are there's going to be a security issue because they're probably going to be walking around while you're working. So there's all of these other little things, but I don't know that anyone's actually solved the problem of having other people, you know, looking over your shoulder while you're working and that sort of thing. So it is a challenge.
They have also suggested at the moment, Steve, that they would like to install cameras in people's homes so they can see what people are doing. Now, that's actually illegal, but that has been suggested. The other thing, the other thing that which is mind-boggling for me, and I get the other people around, is that when somebody works in office, they are trusted employees. The minute they work from home, they are no longer trusted. So it's all of a sudden I leave the office and therefore I get the two horns and the tail and the trident and I'm the devil and I'm going to rip off company records. They can't tell whether you're not using your mobile phone to take screenshots, let alone anybody else in the place. What we do know is that, many banks actually blank out any of the numbers that people need to know. It's not visible to people, and they certainly can't see people's passwords or PINs. They're not available. So they're looking at it from security. We know from judging overseas, Andy and I were fortunate to judge overseas. There was the use of cameras on the laptop to see what people are doing, to reverse the camera so they could look at you. Doing whatever it is you're doing, and I hope not, because sometimes I'm not working in my best outfit. So there's some various things. I mean, obviously the VPN is the standard that most organisations have gone with, but I don't think we'll ever have the answer that's 100% secure or compliant.
How about the question about whether contact center become more important?
Yeah, look, I think as far as company management's concerned, I think they're starting to realise that it is becoming more important, because as there's less and less people using face-to-face channels, more and more people have to come in through the contact centre. And I certainly hope that senior management is starting to appreciate that.
I see.
What I have a problem with, I guess, is the general public thinking it's becoming more important. And I think as an industry, we don't do this very well. In India, for example, a contact centre is a very prestigious job. Most people that work in a contact centre have tertiary qualifications and are highly respected. In Australia, it's not the case. In Australia, in many instances, it's still seen as an entry-level role or a temporary employment until you find another job. It's changing, but not to the same degree. And I think there's still a public perception around contact centres which is perhaps not all that favourable. And I think as an industry overall, we need to change that perception in order that our staff get the respect that they need, and also that we can actually attract appropriate talent.
I see. Maybe they need to increase the salary.
Our salaries are very high. Our salaries are very high.
Absolutely.
You already mentioned 60,000
entry
$60,000
level
a year, straight out of high school.
Yeah, straight. Yeah, so it's a really good job for a young person, certainly during the period in which they're going off and getting their degrees, because of the flexibility that contact centres offer in terms of the hours that you can work and the availability. I would agree. The age-old challenge that we have is with the general public around contact centres. As I said, I've worked in contact centres for over 40 years. It's never been any different.
No.
And in fact, when I started, I didn't even know what a contact centre was. It was, I was in a room with 23 other girls and 3 male managers, and there was always male leaders, all saying you will never be a leader in a contact centre because it's a man's job.
Boy, hasn't that changed?
Oh, actually, but not at the top end though, Steve. Still well below where we need to be. Glass ceiling. 73% of people that work in contact centres are women. Leadership is down to between 30 and 40%. So it drops really significantly.
Yeah, it does.
Okay. Any other question from participant? I think one more question before we are closing the. Any others? Yeah, there is another chat from Sudivyo. Is it contact center considered as casual job?
Part of the workforce, but most contact centres go for permanent employees, either full-time or part-time, and then temporary and casual after that. And they use the temps and the casuals to supplement the main workplace, workforce.
And I'd probably suggest that a lot of the outbound is probably more temp and casual than inbound, because they use a couple of hours or a window of just a few hours in the evening in order to dial people and things like that. So that the proportion of temps and casuals is probably higher in outbound than it is in inbound servicing. Would you agree, Fiona?
Yeah, I would, Steve. But I look at outbound proportionate to the whole size of the industry, and it's a very small component, isn't it?
Of course. Yes, it is.
But yes, proportionate to the size of outbound, then yes, casuals would be the focus in that, because nobody wants to do it. That's the other thing.
Yeah.
But it also
that's why offshore become the option for that one. But the situation is changing. Yeah.
Yes. Yeah, it is. We did see a lot of outbound offshore because a lot of Australians didn't want to do the job.
Yeah.
But on the same token, it does suit some people, because people like university students, for example, can go to lectures during the day, then go into a call centre and do 3 or 4 hours of outbound selling each night or each evening in a very small window, and they get quite good money for it. Sometimes it also helps, working parents. When one parent has a full-time job, they come home, the other parent goes and does a couple of hours in the contact centre. Because the outbound stuff tends to be more evening-based, you tend to get a lot more sort of 5 or 6 o'clock at night through to 9 o'clock at night, whereas inbound servicing is more business hours during the day.
Yeah. You want to add, Fiona?
No. That's correct.
Okay.
Yeah.
I think the time is almost at the end. So maybe I want to ask a closing statement or summary. What is your suggestion for leader in the post-pandemic? What do you think, Steve?
Look, it's a difficult one. I don't think there is a single right answer. In terms of staff, I think Fiona's absolutely correct. You've got to talk to your staff. If you don't understand your staff, their personal situation, their family situation, what drives them, what motivates them, you're starting behind the 8 ball. You're going to have a problem retaining and motivating those staff if you don't understand them. You also need to understand what you've got as far as technology is concerned and start to build a brand new strategy for what's going forward. I think the only clear thing is that we don't know what normal looks like anymore. All right? Things are not normal, and we don't know what normal is going to be. So we need to be flexible. Companies need to be flexible, but staff need to be flexible. But it's a matter of really, there's no one size fits all. It's a matter of understanding what suits you, what suits your staff, and what suits your business.
Yes. Thank you, Steve. Fiona?
We don't think that was great, Steve. We don't know what the new normal is. The new normal is that we don't know, and that we just have to be, like contact centres have been ad infinitum, dynamic, flexible, ready to take on change, and contact centres are known for that, and people that work in contact centres tend to like to work in a putting out fires type situation. perhaps not the fire that we've had for the last 2 years. You know, and we could add in Australia the floods, we could add the bushfires, and the flood situation that we have currently in Queensland and New South Wales. So Steve has hit the nail on the head. The word is flexibility. Is there a silver bullet for that? No, because we have to be flexible, and by definition, a bullet's not flexible. And so we just need to go with it and make our best assessments for all the right reasons and act with integrity right the way through for our organisations and our people, because they're not disconnected. They are one, and our customers, and make sure that whatever it is we do for all the right reasons going forward. Yeah.
So we always be ready to the next.
Whatever you want to change, let's change it, Andy. Let's do it.
Yeah.
But don't do change just for the sake of change. Do change that makes sense.
Yes. So we need to adapt with this situation, and leader have to take the lead. Yeah, of course, of the teams. Yeah.
Yes, very much.
Okay.
Fearless leaders.
Yes, leaders. Yeah, that's why we are talking about the leaders today. Yeah. Anyway, thank you for Steve and Fiona. Very nice discussion this morning. Hopefully you enjoyed the discussion as well. And thank you for the contribution to the Cc-Apac as well. Hopefully next time we will discuss another things with more insight about the contact center.
Thanks, Andy, and thank you to everybody who's attended. Yes, it's been great. Been really enjoyable to speak to everybody again. And Andy, if you feel like sharing my contact details at some stage, if anyone wants to reach out at any point, they're more than welcome to do so.
Sure. Yeah, we'll share your. Please, if you want to have contact with Steve, I will share you the email in the chatting.
Mm-hmm.
Okay.
Thanks, Andy, for the opportunity. Good to see the Indonesian team there, and
hopefully we can invite you again to come to Jakarta and see the Sunday morning running.
I want my Sunday morning walk through Jakarta. I love
that. Would be marvelous.
Okay, thank you again, and all participants. Can we take photo together if you want? If not, we just end this one. Thank you very much, and see you for the next Cc-Apac leaders next 2 weeks from now. Yeah. Thank you.
Thank you, everybody. Thank you very much.
Yeah. Bye. Stay healthy and safe.
Thank you. Bye-bye.
Bye.